Welcome to This Wasn't the Plan podcast. I'm Kali.
And I'm Brittany.
And we're two best friends who met during breast cancer treatment in our 30s. This rocked our world, but we managed to get through it together. We've laughed, cried, and learned a lot along the way.
This is our real, raw, and honest journey, and we're here to help you feel less alone in yours. Thanks for listening. Now let's get on with the show.
Hello.
Hi.
How you doing?
I am good. How are you?
I'm good. I'm excited to be chit-chatting. I love the red headband.
Thank you. It's my we can do it, join the army girl look.
Rosie the Riveter?
Rosie the Riveter. That's the person I couldn't think of their name. Yeah, sort of.
No, but it's so cute. I just love that color on you. Red's your color.
Thank you. Gosh, okay. I feel like we have a lot to update our listeners on because they're obviously super invested in us.
Mm-hmm.
But do you want to give a little update on what's going on with you before we?
Yeah, sure.
Okay.
So I'm pretty sure last I shared I had gotten a mammogram. I think it's like October 7th. And I was going down for an MRI. The MRI, so the mammogram showed that the residual calcifications, as they call it, are the same size that they were. The things that I was trying didn't move the needle on that. The MRI did show, and I've had to try to dig into the internet and understand exactly what all these mean. The MRI measures vascular activity, so like blood vessels, and that is shrinking. So,
That's good.
PET scan obviously is showing there's there's no active cancer, but yeah, it's great that is shrinking. However, because of the residual calcifications that are unchanged, my surgery options haven't changed, which is a bummer, but I think we've talked a lot about just I don't know, I think we've even talked about that proverb that's like the guy who's in a flood and asked for God to save him, and I think at one point you were like, maybe this is your boat, because a boat comes by and it's like, hey, you want to get in? And he's like, no, God's gonna save me. And it happens a few more times. And so yeah, I'm just kind of figuring that piece out. I have a consult with a surgeon or a plastic surgeon in January. They book really far out. Sadly, I think they are busy people. But looking at a surgery in winter 2026, I think. So it's weird because I think I've thought about it for so long. I have a level of peace with it, and just I'm ready to move forward and stop just living in a weird in between of am I going to do this? Am I not? So
Yeah,
that's where I'm at.
I think it's great, and I'm glad you have peace with it.
Yeah.
And I'm sure there's people listening that have had to make that decision, or maybe process of making that decision. And yeah, it's not a fun decision to make.
So yeah, that's my update. And more to come. I haven't made any final decisions, and we'll kind of keep sharing as those are made. But you've got an update too, I think. You want to share what's going on with you?
So, not the news I wanted to share, but I got my PET scan results back, and they weren't what I wanted, but kind of what I was expecting. There was some progression in some bone areas, like in my spine and my sacrum. And there was a new tumor on my liver. It's small, and SUV is not that high. So obviously, I was pretty upset about it to, and it was just, it's been a very stressful month. And with the PET scan and, being in this cancer world, I don't think it's talked about a lot, is how hard it is to have so many friends with cancer. And it's hard enough. I imagine if I had never had cancer and I had a friend going through it, it would be so hard because I love my friend. I would care for them. It would be hard. But here I am with it. And then I have all these friends with it. And it's you care about them and you're all on this journey, and it's like it becomes really overwhelming. And I feel like there was like a lot of stuff in our community, like right like before my scan, and then like during our scan we lost a really good friend of ours, and I haven't even like been able to like process it. And um it's just like a really hard time right now. And so while it wasn't the news I wanted, I'm grateful that it wasn't anywhere else. And the SUV scores aren't terribly high. um so there's some positives. And then I'm coming up with a plan with my doctors that I feel way better about. I started a new immunotherapy in August, and I was skeptical about it. Yeah, rightfully so, because it didn't work, and I have like progression. So I feel really good about my next steps. I'm gonna probably be going away. Well, definitely going to a place for like an intensive 3-week treatment. Um, and it's gonna stink leaving my son and my husband, but it'll be like the first time I ever like go through treatment where like I just have to focus on myself, and um there's like the emotional and like spiritual side of healing, I think, is very underlooked, undervalued, but it's so important. And I have said it before, it's been a huge part of my healing. But I have like some way to go with that. So I'm excited, I guess. Not excited. Excited is really not the word, but I'm I'm looking forward to healing. I really still believe it's in my future. This is like been a difficult time, but I have such an amazing support system. I'm sort of like retreating a little. So if you message me and I haven't messaged you back, I'm so sorry. I'm in I don't know, not isolation, but sort of like I just have to like self my friend always says it's not being selfish, it's self-preservation. And I sort of have to like retreat a little from my cancer world and just like focus on myself and my healing right now. And so that's like a long story, not short. No, that was a short story long is what that was. But
No.
um yeah, so that's my update. I was really
No.
looking forward to sharing like good news, but I will one day, just not today.
Delayed gratification.
Yeah, and like, that's the thing. We did this podcast in the midst of our journeys, and I think um it's relatable that like this is there's ups and downs, and the downs are really tough, and this journey sometimes feels like it's never ending. It's financially just out of control, and it can feel so frustrating. And I've been we talked about in Faith last week the dark night of the soul. I feel like I'm on that right now
I thought
again.
it was really, interesting just, like, launching that episode and listening to even, like, the reel that I pulled from the episode, and I knew you were, like, in it again, and I was just like, "Ugh," like, I hate that this is timely, but, what I've seen from you is, like, such a resilience and, like, I think I don't know how like, I think resilience is the right word because like, certainly bounce back is not the right word, but, like, I've seen you catch yourself a lot and, like, just come back to, like, the grounding truths that you believe, and, like, you've inspired me a lot, so
Hmm. Thank you. Yeah, I mean, I would say I I have to be resilient because the other option is like giving up, and like obviously I'm not going to do that. But it's these scans are just like everybody who's had cancer knows they're horrible. Just the whole process so stressful. Getting a bad scan, just like waiting for the results, seeing the results, reading the results, and having to tell people the results. It's so stressful. So yeah, the scans, they're awful, and I know everybody who's been through it knows, and they're just I don't know if they'll ever get easier, honestly. Like, even when I do have that no evidence of disease, like, it just sucks. And
Mhm.
yeah, I the hardest part is having to tell everybody all the people you love the bad news because, you just don't, it's no fun. It's just the worst.
You want to bring them
But
the good news.
one day I will bring them good news and I look forward to that. But, yeah, so that's my news. But we have another episode today to
Mhm.
kind of, change the subject, sort of.
Yeah.
Um,
It was
what's
kind of a
this?
short and sweet one.
Mhm.
What were we talking about in today's episode?
These are very personal, but there are top 5 things we wish we would have known before we were diagnosed with cancer. Obviously, they're extremely specific to us because every cancer diagnosis is different. Everybody is different. Um, and it's funny, like we filmed this in like July, I think,
Uh-huh.
and I've actually learned more about my body since then that I feel like I probably would have added to the list, like my cavitation surgery. Like, I don't know, it's just interesting. But I think anybody listening, even though it is specific to us, could maybe learn something from
Yeah,
some of these tips because they can apply to others. And we just want to spread like information that could help you prevent this. That's like our goal.
totally. Yeah. And I think when we talked about, we've had a lot of conversations around like I've heard someone one time say like if you are like surveilling for a root cause, like the thing, because like when I got diagnosed, I was like, I'm gonna find the thing. Like there is a thing that caused this, and I'm gonna find it. And like I thought, I was gonna get a total tox burden, and my mold was just gonna be off the charts, and I was gonna be like, I knew it was that college dorm room.
Mhm.
But, I think what we've come to learn is it is a perfect storm. And if you hear one of these things and you're like, "Oh my gosh, I have that," or "My child has that," or whatever, um, like these are not like, "Oh, I had this and that caused cancer." But it is stuff where it's like, "Ooh, all of those together, overlooked, I think created an environment that allowed something like this to happen." And,
Mhm.
um, how do we get proactive or listen to, one other thing we talk a lot about is like, if something feels off, dig into it. And if that provider doesn't, you know, want to get run that lab or whatever, 2 things you can do. One is say, "Okay, would you please note in my chart that, I've talked to you about this and you refuse to do the lab?" And then 2 is find another provider.
Totally. I always say like our bodies speak to us, and some people are really good at listening to their bodies. I think I'm really good at it now. I wasn't in the past. And, I always say, like, you are the best advocate for yourself and your health. Like, nobody cares about you more than you. And so, advocate for yourself with your doctors. If those doctors don't like what you're saying, don't want to help, great. I'll find a new one, find doctors that support you. I have amazing doctors and nurses that like listen to me and like hear what I'm saying. And it's such an amazing thing when you do find that. But we won't, you know, we don't want to drag on here, but I hope you guys enjoy the episode and let us know what you think.
Come back next week.
Okay, bye.
Bye.
Well, not bye. Just listen to the episode.
Hi, welcome back to This Wasn't the Plan podcast. I'm Brittany.
I'm Kali.
And today we are talking about advice we would give our precancer selves. So we each came up with a list of 5 things. They're super bio-individual, which means that it's based on our unique health history and the things that we know now that looking back we would do a little bit differently or wish that we might have learned a little bit earlier. So it's not about regrets and harboring what we should have done. It's more about, hey, these are things that we know now, and if they can help somebody else, that's awesome.
Yeah, let's start.
Okay, so I'm going to give my top 5.
Okay.
And you can give yours. Yeah. So my first one that I have been learning about and looking back, I am just a stereotypical case for is learning about airway health.
Okay.
So I am not an expert on this, but every time I read about it or listen to a podcast on it, I realize that if the information that's out there now had been readily available for parents in the 90s, I think that a lot of things could have gone a little differently for me.
So what does that mean when you say airway health?
So there are a host of symptoms that I had that are all associated with not getting enough oxygen, whether that's because your palate is too small or you have a blocked airway because of, you have a tongue tie or you're tight or you have like physical obstructions. It's really wild the things that they lead to. So again, it is one thing that I am maybe in the intermediate phase of learning. So I'm not going to this isn't me being the expert telling everyone about it, but I might link in the show notes a few podcasts that I listened to that were really good. So some things that for me, I had so many ear infections growing up.
Okay.
I had tubes 3 times.
Wow.
I had my adenoids taken out, which I did not know until I went to my integrative doctor, and she was asking about my health history, and I had my mom send me my baby book, and I was like, wait, I had my adenoids out, and it was like, yeah, that's what, they still do that.
I don't even know what an adenoid is, if I'm being honest.
I don't either. I don't have them, so why would I know?
Okay. All right.
No, it's somewhere within your tonsil area, and if they're too big, it can maybe cause a block here, or it contributes to ear infections, which is true. And it is still a treatment for chronic ear infections, but I think there are other ways that you can, even if you have to do those things, just knowing what else it can lead to down the road, you can work on that so that, I was a mouth breather. I still am when I sleep. I often have an open mouth. All of that can be tied to, if you look at kids and their progression down the road is bedwetting till an older age. I was in 2nd grade still wearing pull-ups, and that was so embarrassing for me. And obviously it's I'm looking back, I'm like, oh, you were a child, it's not your fault.
No, of
but
course not.
that was, and who would know that those things are very much related to airway issues, and then down the road ADHD. So then you start saying, okay, what does this create? A low oxygen environment. And now I'm like, okay, that I think is one of those things that if I, have a child one day and I see those signs, we can do something about it and maybe start to support them where the ADHD symptoms might not present as strongly, or the ear infections might subside, or you can get in front of them before you have to do antibiotics all the time,
Which affects your gut, which affects
it's just
cancer. Yeah.
Such a downstream thing.
That's interesting.
Yeah, that it's something I'm intrigued to know more about, and I think there's a lot more information coming out about it.
Well, having a 2-year-old who sleeps with his mouth open, now I'm like, okay, I need to go figure this out. See, that's good information. Yeah,
and I think you have to tread lightly. I have mom friends who then get really perfectionistic and stressed about it, and if their baby is sleeping with their mouth open or whatever, it's it's a long game.
Yeah.
And I have a friend who has a 9-year-old, and they just did a bunch of airway work with him, and he got a tonsil surgery done, 2 tonsil surgeries done because insurance wouldn't pay for both at the same time, and all sorts of things, and he's getting his palate expanded. So and for him it was linked to rage and aggressive behavior.
Oh, wow.
And they say that the doctors that she's seeing are saying that they will likely see those behaviors resolve or subside as he's able to, and he had an 80% blocked airway.
Wow.
Yeah.
That's
super fascinating. So
okay, so that's your
that's one. And I think it leads into number 2, which is to just look into root cause of some of the things that I was facing as older teen. You go through puberty, and I had ADHD, and mine was just inattentive, and I just took so long to read and study, and I'd stay up all night on Adderall because I just needed to focus, and I cared so much about great grades and all of that. And then I was on Adderall for 8 years, and finally in like 2018, I went off of it cold turkey, which was not a great idea. And
Do you get addicted to, like, what happens when you get off Adderall?
because it's like a stimulant. And there are so many just, substances that your doctor should walk you through a weaning process. Theme of the podcast, doctors walking you through weaning processes.
Okay.
Yours was breastfeeding, mine's Adderall.
Yeah.
But I got really lightheaded all the time. And I mean, I was falling asleep on my desk at work.
Oh my gosh.
And like the scary one was the lightheadedness. I was like, am I going to pass out? Like, what's going on? I didn't trust my doctor at that point. That is one of the people that like was a notch in the wood of my... I'm not like a strong distrust all doctors person, but I am very cautious about who I align myself with now.
Yeah.
Because I told her for 3 years, there's something going on with me. My feet are always numb. My knees are purple. I don't know what's happening. And like, she wanted to get me tested and like put me on meds for Raynaud's. And never once did she say, hey, you've been on Adderall for a long time. That might be a side effect. Let's look into it, or anything. And so I was just like, I think I would have, I think in college, like in order for me to get good grades, it was like a support.
Yeah.
I didn't need to be on it at that point in my life. So I think looking into root cause, now managing my ADHD and like my zoning out and all of that with, well, first of all, looking a little deeper and seeing my adrenal fatigue and trying to support that. Exercise, getting sunlight in the morning, doing things that support my energy levels so that, I think I also was just an incredibly fatigued person and didn't know it.
Yeah.
So that is one. Another one kind of under this umbrella of looking at root cause is like I had really bad acne from 7th grade till like freshman year of college. And I'd been on like doxycycline or tetracycline, which is an antibiotic, for like years.
Wow.
For acne. Didn't work. I was on topicals. I was doing basically everything but Accutane. And I mean, this is damaging to like self-esteem for sure.
Yeah.
And then they put me on birth control at 18, 19. And that was the first thing that like really worked. And it could have been that I was growing out of it, but for sure by the time I'm in my early 20s, I was just like so happy I finally had skin that I wasn't like, I could go places and not wear a full foundation makeup, and that was freeing, which is so real as an adolescent. But then I just stayed on birth control for 10 years, not really needing it, but being like, I don't want to have acne.
Yeah.
And that is, I think, one of the top things that led to my diagnosis. There's studies out there showing, especially the progestin-only mini pill, which is what I was on for like 5 of those years, there's a higher risk of breast cancer. And so knowing some of my methylation issues and the fact that I don't process hormones very well, and then I was just jacking them up.
Yeah.
And then all of the symptoms that started when I came off of birth control, and again, they weren't super, super severe. It wasn't like I had debilitating cramps or really heavy periods or anything like that. So yeah, I think taking a look at some of the medications you're on, looking at the root cause of the thing that you have medications for, and maybe asking a few doctors would be my piece of advice. It empowers the patient and it can help people not look back and be like, wow, why was I on that medication for 8 years,
Yeah.
Okay, that actually kind of leads into number 3, which is learn about methylation, phase 1, 2, and 3, detox.
Okay.
So you and I have talked a lot about methylation.
Yes.
And for each of us, that is a contributing factor to our diagnosis. I think we're going to have a podcast episode on methylation to explain it, but there are different genes in your methylation pathway. There's like 5 or 6 that we got tested, and I had a double COMT mutation and a single MTHFR mutation. And what that shows up as is with MTHFR, I mean, this is the most high level, easy explanation. It interferes with your detoxification pathways, and excuse me, if you have like a single mutation, I think it's like a 30-40% interference with your, and if it's a double, it's like a 70 to 80% interference. What's yours?
I don't remember if it was, I can't remember which ones were single or double, but I just remember my doctor telling me basically my liver is only working at 20% of its ability.
Whoa.
So
Oh,
with
man.
all mine, with all mine.
Yeah.
So
So
on top.
same doctor who told you that, like when we looked at, well, before we even got mine done, I had talked, and she's a very intuitive person.
Yeah.
And I talked about some of my symptoms, and like we really didn't know each other that well. And she's like, honestly, like I just know that you have a COMT mutation because everything you're saying, you're anxious, have ADHD diagnosis, all of these things. And COMT mutation was probably one of the most life-changing pieces of information I've ever received because it explained so much. Maybe that and the airway, because I think those made everything make sense. So with COMT, that one interferes with your body's ability to break down neurotransmitters. So think your dopamine levels are jacked up, your serotonin, and that leads to the anxiety, depression, ADHD, all of those things. It also leads to like insomnia and issues with that. It interferes with your ability to break down sex hormones, so like estrogen and testosterone. It is proven to, and it says in the sheet, linked to breast cancer or hormonally driven cancers.
Yeah.
So that one was, and that I think is where you get into I'm not going to get in the weeds on the phase 1, 2, 3 detox, but that's where your liver is impaired. And there are 3 phases of getting rid of the hormones so that they don't become like the bad version and keep recycling in your body. So I think learning about methylation would have helped me supplement use the right kinds of supplements, avoid foods that have things like folic acid, which is supplemented in literally any kind of like grain product you buy at the store, bread, wheat product.
Yeah. Didn't you think it was like a good thing back in the day when it said like
Yeah.
that it had riboflavin and
You can get vitamins.
so oh great, I'm having bread and vitamins.
Good.
This is good for me. Yeah, and everything is, and it doesn't. There's a word that they say when they put it in there, and I can't think of what the word is, but
Methyl.
No. Like on the package and the ingredients, it says like like fortified. It's fortified, and you're like, well, that sounds like a
which
good
I
thing.
think is because they saw these deficiencies and they saw that the American public is moving toward a more processed food diet. So you're not getting folate is present in foliage, leafy greens. You're going to get a lot of folate in those. And so people stop eating that. They're eating breads and pastas and cereals. So we just put the fake version that your body has to convert into it. And then I think I think it's around 40-50% of the American public has an MTHFR mutation. It's not like
pretty high.
This crazy little mutation that only a few people have or anything.
Yeah.
And so I think it can lead to a lot of things. And I think if people start there and support those pathways, you might see a lot of changes to the other things you're working on.
Yeah.
So I think that is another one. I think a fourth one is emotional suppression and people pleasing are detrimental to your health. I wanted to think of not just physical because that's not representative of our healing journey. I could go on about more physical things, but I think a huge one is that feeling. Like I'm a pretty emotional person. I'm a pretty emotionally expressive person, but I think as I became an adult, I realized it's not appropriate to get emotional in certain settings. And that's what I told myself. And so I would just kind of shove it down, or because I was a little, perfectionistic, didn't want to show that I had issues. I was like, no, I'm fine. Everything's fine. And that does manifest in your health. And it manifested in a lot of ways for me. But I do think that there's like Chinese medicine believes that like traps your chi. And so do you have any thoughts on that? I know we've talked about it a lot.
Yeah. I mean, I'm a massive people pleaser. I needed to please the people. And
Same.
When you do that, you are neglecting the most important person, and that's yourself.
Yeah.
And like that neglect can manifest in like not paying attention to these symptoms that you're having that could be something serious, or overextending yourself, not resting. I mean, it just like goes on and on and on.
Yeah, for sure. I mean, when you think about how people pleasing shows up in your life, I think sitting down and writing down a day in your life and how every decision you make, when did you make it to please someone else? And that's not to say we don't want to like love other people and think of other people and all of that. It's complicated, but I do think when you're, not listening to your own needs, and making decisions for other people, you can get yourself in some issues.
Yeah. It's not a good quality.
Mm-hmm. That actually kind of leads me into my last one. I think I always wanted to say yes to everything. Mm-hmm. And so what was the one thing that I could cut to make more hours in the day? That was my sleep. And I was a chronic undersleeper. And pair that with a girl with an Adderall prescription, life worked out okay.
Yeah.
For a while.
Yeah.
So in middle school, no, high school, it was middle school, 8th grade, I was so busy. I just love all the activities. I want to say yes to everything, the volleyball team, the theater, the choir. I want to be an A student. Just wanted to do it all. Mm-hmm. And some people can do that, but I think my ADHD, it would have been wise for me to say no to things and prioritize sleep. And I wasn't. So I was up late and I would hide energy drinks in my locker.
Oh my God.
In 8th grade and drink them.
Wow.
And so that I could stay awake in class because I didn't want to be a bad student. Didn't want to make people mad at me. Yeah. I did the same thing in high school. And then college, that's when I got on Adderall. I was sleeping like 4 hours a night.
4 hours a night? Mm-hmm. Oh my God. For how many years? For
3 years in college. I think by actually every year of college. And then I got out of college. I continued to want to do it all, be social, work I had 3 jobs at one point, was going out to the line dancing bars after. Yeah. And I continued, 6 hours a night. My roommate would be like, Brittany can do it all, Yeah. And it was like this good thing. And now I'm like, no, it's not.
Yeah.
So I just started to learn to slow down, rest, give myself a slower pace of life, and not compare myself to others who maybe also need the rest and are ignoring their bodies. You just don't know. So that's my 5.
No, those are great. We're going to have some overlaps here, but do you want to say anything else about yours before I say what mine were?
No, I think, it was an interesting exercise. And again, like holding it, like having forgiveness from yourself and being like, you did with the information you had, you did the best you could.
Yeah.
And we can do a lot to help other people with this information and help our families. So, yeah.
Okay, so I'm going to give my top 5 list of things I wish I would have known before my cancer diagnosis. My first one is take a methylation test. So
ooh, yeah, girl.
You did a great job explaining it. But I had anxiety my whole life. I really suffered from anxiety. Sometimes I'd have a little depression that would go in and out. Well, I didn't know, but I had so many symptoms of hormonal imbalance. Like my periods were it could be terrible, and I would get really, really like overly emotional. I would get depressed. I would get super anxious. I had extremely sore breasts. Like they were really tender. They hurt really bad.
Oh, I'm glad you said that. That is one thing looking back I wish I knew. That is not normal to have very, very sore, tender breasts.
Yep.
Yeah.
And I had really bad cramps. Also not a normal thing. Common, not normal. So had I known, so when I did my methylation test, my doctor looked at it and she went, wow. She goes, I'm like, wow, good? You excited about this one? She goes, no, this is one of the worst ones I've ever seen. I go,
no.
She goes, no wonder what? Like I was like, okay. So you said that they tested 5. I had 4 out of the 5. And she said the 5th one is extremely rare. No one really has that. So I basically had 4 out of 4.
Yeah. You got 100% on that test,
yeah,
baby.
I got MTHFR, I had COMT, I had MTR, and MTRR. And so that's when she told me, like, your liver does not work like a normal liver. It is not processing your toxins, your hormones. Like, you're basically working at 20%.
And tell me about your life from 20 to 30.
20 years old.
From 20 years old to 30 years old, and what was your liver?
Well,
your poor liver
unfortunately,
doing?
I didn't treat my liver very well. I drank quite a bit, and I loved perfume. I loved candles. I loved like lotions. I mean, I
We're
like the girl stuff.
normal American
nail
girls.
polish. I was
Yes.
obsessed with nail polish. Now I use all non-toxic, but all of that stuff has, estrogens in it, which is a fake form of estrogen that, like, maybe somebody with a liver working at 100% could process that estrogen out, those, bad estrogens as they call them, and I wouldn't have had estrogen dominance, but I did. And over time, like, just and I would have considered myself like healthy by what you just kind of, you're like, oh, she eats pretty well, like I cooked a lot, I didn't eat fast food. But no, like anything I was breathing, eating, drinking, putting on me was going in my body and staying in my body, which eventually led to finding out that I had an extreme amount of toxins in my body at my cancer diagnosis. So that would be my number one tip. I think everyone should get a methylation test. Everyone.
And
understand
they're like
it.
$150. They're not expensive.
They're not that expensive. There's a lot of ways once you find out if you do have any, they call them SNPs. If you have any, you can supplement to like simple supplements.
Yeah, they're not a doom and gloom like sentence or anything.
Yeah, it's not like some crazy, cancer diagnosis. I don't know. So that was my number one thing. Number two is to make detoxing part of my weekly life. I don't know that I would have like totally changed my lifestyle. Like I probably would have still gone out. Maybe I still would have drank, but I think I would have just, if I could really understand what detoxing means and then actually put it into my daily life and put it into practice, I think I would have, I don't know, maybe I was always meant to get breast cancer, but sometimes I like to think maybe I could have done it when I wasn't 37 at the end of my my fertility journey at 35. But so I would have maybe tried to, there's different ways to detox. There's sweating, there's pooping, there's peeing, there's breathing, right? Breathing is...
the three that I know are, I always say poop, pee, and perspiration.
Yeah, okay. So, but like also binding.
Yes.
You're taking binders, bind to the toxins, which help eliminate them out your body. I would have liked to known about that and known the importance of that, because in this life, even if you're trying to be careful, which we are, like there's just no way to escape the toxins in this world. Like you're inundated with it in this world. But if you can make detoxing a common practice in your life, I think it could help prevent a lot of problems.
Can we get weird for a second?
Yeah.
I think
Always weird.
with elimination pathways.
Yeah.
This is stuff that like I hear all the time, you hear all the time, but like I forget people don't know, and at one point I heard for the first time. How often should you be pooping?
Okay, I've heard 3 times a day.
I think it at the very least 1 time a day, up to like 1 to 3.
Yeah.
And I like you should pay attention to it.
Yeah.
And if you told me 5 years ago that I would be on a camera talking about poop, I would have crawled under a rock. But like I didn't talk about it. I didn't pay attention to it. And I think like paying attention to that and being like, oh, something's wrong. That's an indicator. And same with if you're sweating, if you're not sweating, like that's not a good sign.
Here's a major difference between us. If you would have told me 5 years ago I'd be on camera talking about poop, I would have said, yeah, that checks out. Because I grew up with a dad who was a chiropractor, and when we got sick, the first thing he asked us was, did you poop? Have you pooped? And I'd be like,
you gotta check.
And so it was just like very
Check on your loved
normal.
ones.
Like it was just like a very normal thing. Like that was like your first sign of like, okay, things aren't working. If you're not going to the bathroom regularly, things aren't working. And so it was like very normal. And I know friends of mine thought I was weird because I talked about it so much. But I mean, it's just a very real thing.
It's an easy way. It's like, kind of like people say your period is a 5th vital sign. I think that these things like, oh, I'm working out and I'm not sweating at all. I'm going to a sauna and it takes me 20 minutes to break a sweat.
Yeah.
Or, I poop.
I mean, we could have a
3
whole
days.
episode about poop, and we probably will, because it's not just are you going or you're not. Like, is it healthy? We'll ease you into it as a listener, but it's
for our listeners who aren't like this, I think it's good to know.
It's just good to know. Yeah. Thanks for talking about that. Okay, number 3 is be nicer to myself. Your words and your thoughts matter. And I was so hard on myself for so many years. I was just honestly like my worst critic. I just felt feelings of shame and guilt, and I'd have a conversation with someone and I'd walk away like replaying it. And I can't say that I'm like 100% nice to myself now, but I know to be nicer, and I am trying to be. And especially after everything I've been through, I still sometimes minimize it, and it's like, no, what are you doing? And it's like that self-esteem, like your self-esteem really matters, because it really plays in, it's more complicated. I think it really leans into depression and to anxiety, and it affects your nervous system, and your nervous system is one of your systems that can affect, cancer, or enables cancer to grow, and giving like the perfect storm for cancer, right? And contributing to that. And I just would say, be nicer to yourself. Like, it's hard to be a girl. It just is. And just to like live in this world sometimes. And everyone is truly doing their best. And, I don't know why I was just so hard on myself. I know a lot of it's like trying to be perfect, and it's a terrible trait. Nobody's perfect. And
I heard you say earlier that you wanted to be the best at everything. Do you feel like that kind of played into it?
Yeah. So like, you're not the best. And then because you can't be the best, you feel like, oh, you let yourself down.
Crap, yeah.
Yeah, and then you're like, crap, I'm not the best. I didn't call her on her birthday. I'm the worst friend, And it's like, yeah, I don't know. I don't know why. I don't know where that ever started, but just be nicer to yourself. Like, you're awesome. Whoever's listening. And somebody, I don't know if it was a therapist. I think it was one of my EVOX therapists told me during the cancer diagnosis to start congratulating yourself on every little thing you did. Like, literally, like if you went to the grocery store and you got groceries that day, say, great job, you went to the grocery store, you were able to provide for your family and make dinner. And I was like, that's so stupid, but I did that, and it actually really worked. The more it's also kind of aligned with like the affirmations that they tell us to do when we get diagnosed, like, you are strong, you are healing, you are resilient. And it's like, you may not believe them at first, but the more you start saying it, congratulating yourself, like cheering yourself on, like it does change you, and it does help you. And so be nicer to yourself. Myself. Number 4 is use non-toxic beauty products. I guess it's like kind of part of methylation and like detoxing, but honestly, I used a lot of products that weren't. I think about growing up, and I was obsessed with like Victoria's Secret and Bath and Body Works, and I loved like getting the new scent and lathering it on, and all the makeup and nail polish,
wallflowers, and the everything,
and how that affected. I got my period at like 10 years old. I think it was like 10, or I was in 6th grade. I was really young.
Same.
And that's something they ask you when you get breast cancer, like, when did you start menses?
Is that, they do. Is that because the earlier you get it is a bad sign?
Yeah, it's like, I guess it's like, it means you have a higher chance of getting breast cancer.
Okay.
Something like that. You could fact check me on that, but I'm pretty sure that's what they told me.
I know they ask, and that would make sense. Yeah.
And I mean, think about all the bad estrogens we were putting on and in our bodies. Like, it was probably like, I feel like I induced my own period, I guess. But, so I would say definitely use non-toxic beauty products. And then number 5 is, just because something is common, it doesn't mean doesn't make it normal. So I said that earlier. I feel like I felt off for so many years, whether it was like I feel anxious, or I'm tired a lot, or I have like anger issues. Yeah. I get nauseous sometimes, and I'm like, but a lot of people felt that way.
Right.
Everyone had anxiety. Everyone I knew had anxiety or some sort of like disorder, and it was always just like, okay, just go get on medication, you'll feel better. And that was very common, and I was on anxiety medication like a few times throughout my 20s, and even like in my early 30s, I would go on and off of it, and I just never really felt great. And I always feel like there was something wrong, but it's like that inner voice. and you just don't really listen to it, but you know something's off. Like during the pandemic, I felt so off. Like I was like holding on to weight, and I had always been like, pretty thin, worked out, whatever, but, and I was like holding on to weight. It was like very inflamed. There was something wrong. Cancer was brewing, but I just like didn't listen to I didn't.
How many
take
years
it
was that before
seriously.
your diagnosis?
That was like 3 years.
Yeah. Yeah, because I was going to say it was about two years before my diagnosis. And it's like it was all in one area of my body, and it's the area it's not supposed to be, like in your stomach, that visceral fat that like just would not leave no matter what I did. And I was beating myself up, like, you gotta work out harder and blah, blah, blah.
Yeah.
And it's like your body's crying out for help.
Yeah, like I wish I would have listened to my body. Now I'm so much better at it. Like when I feel something's off, I take it seriously and I figure out what to do. I always found just the medical system really confusing. Like, who do I call? Where do I go? And I think a lot of people feel that way. It's like, well, where do I start? Like, okay, I do feel off, but like I have friends who have asked me, like, okay, I feel like, I have really bad periods. Like, what should I do? I'm like, okay, well, it's probably a hormonal imbalance. We need to get your hormones checked. Like, where do you go for that? It's like, well, honestly, everything kind of leads back to like a functional medicine doctor because you got to go to root cause.
Yeah. And I've tried, like I told you, I was very into this functional medicine, but right before my diagnosis, I started to really acquire knowledge. I tried to do stuff myself. The naturopathic doctors I was like ordering labs through, interpreting myself, and I just could not. Like, no matter, like, you really do need someone to help you.
Yeah. We're not doctors. No. We're not trying to be.
No. And so I think if $1,200 feels like a lot to you, it's just
prioritizing, because $1,200 would have been way too much for me in my 20s. Like I didn't make any money working where I worked, and that would have been so much for me. But like I could have maybe I don't, like it's just like all about prioritizing your money. So like don't get your nails done, save up for those tests, because I do think it's an investment in your health, and there is no greater investment, because if you do not have health, you don't have anything.
You don't have anything. And nothing else matters at that point.
Once you don't have your health, you're like, why didn't I do these things when I could have? And and some people will hear that and think, and they might not do anything about it. And it's hard to like instill in people like how important it is to put your health first. But I just wish I would have, and I would have gotten I would just listen to all the symptoms that were like piling on top of each other until those symptoms all created the perfect storm and created a big fat tumor in my breast. So those are my top 5.
Those are good top 5.
Yeah.
How did it feel to go through those?
It feels like I don't feel bad.
Yeah.
Because I don't think anybody knows this. I never in my wildest dreams thought I would have breast cancer in my 30s.
Yeah.
I kind of thought maybe in the future, because I have a history of it in my family. But it still didn't ring. It just didn't. It seemed impossible that I would have breast cancer in my 30s, especially while pregnant. And so these things just didn't. The implication of all these symptoms, it didn't really matter to me. It didn't register to me. But I don't feel mad at myself.
Yeah.
I just feel like, okay, I can only share what I know and hope that somebody out there listening hears it and maybe make some changes.
I was telling someone the other day, like, I really hope that, like, as we learn all of this, our children's generation will just, like, when they're our age, will just see, oh, wow, I see why my parents made all these changes and prioritized this. And, like, they're seeing the blessings of it. So,
yeah, I think about that, like, with my son. Obviously everything I'm learning, I'm imparting on my son. He's only 2. He doesn't know. But, like, I want him to grow up understanding health and the value of it and, like, how, like, eating right is, like, such a priority and a privilege and all that stuff. And I don't know how to, like, do it yet. I'm not like mom of the year, but
You are.
I just want to like do my best, obviously, for him, so he doesn't have, because he probably does have some of my methylation issues, and I just want to make sure he's set up. And I think our generation is really learning about that right now. So
Yeah.
I have hope for our kids and for people listening.
For sure. Well, this was a really good 10 pieces of advice.
Yeah.
Some overlapping. Hopefully, yeah. I mean, it's hopefully someone hears something that's like, oh, I didn't know that about methylation or whatever. And yeah, I mean, we're new to this, but by the time this is airing and people are watching, we'll have an Instagram account and we will have hopefully like an email address. And I would love for people to email us and be like, hey, I heard this thing. I would love to hear more about that.
Yeah.
And then we know to, make another episode about it. And yeah, we're just excited to keep this going.
Yeah. Well, with that, thank you for listening and bye.
See you next time.
Thanks for listening to our podcast. We have a big favor to ask. Please hit subscribe and leave a review. It really helps people find us.
Thank you so much, and see you next time.
Bye.